Thank you very much, everyone, for joining. My name is Imran. I am working with the PHC Global. I'm leading the AI-Sarosh Knowledge Hub that is part of the IDRC-funded project, trying to figure out how sexual and reproductive health issues in the globally can be addressed through the use of artificial intelligence. We have an exciting panel with us today from 4 different countries and in different locations, all the way from Australia, and then I'm sitting right now in the United States. So we start this webinar with the introduction of the panelists, and I'll start with myself. As I said, my name is Imran, and I work with PSC Global. So the next, I would request Dr. Lassi to introduce herself.
Okay, hello everyone. I'm Zara Lassi. I am an associate professor at the School of Public Health of the University of Adelaide, and my research mainly focus on the entire continuum of care, which includes sexual, reproductive, maternal health, and adolescent health as well. Thank you. Thank you for having me.
Yeah. Dr. Richard?
Hi, good evening. I'm Mohammed Rishad. I am working for the University of Colombo and as a senior lecturer. And I am also an obstetrician. I'm a clinician and I do my research interest is maternal health. And I am currently doing a PhD in quality improvement project.
Thank you, Dr. Rishad. Dr. Shaheen Akhtar?
Yeah. Hi, good evening. I'm Dr. Shaheen Akhtar. I'm working as the technical director at Infrastructure for Social Development. So it's a national NGO, and we mostly focus our work on the research, advocacy, and the capacity building, and also the business activities. Our current project is a and we are addressing the mental health. And it's good to see you. I'm looking forward for a very interactive discussion.
Thank you, Dr. Shaheen Akhtar. Ms. Homa Mirza?
जी अस्सलाम वालेकुम मेरा नाम हुमा मिर्जा है और मैं माशाल्लाह 5 जवान बच्चों की मां होने के साथ-साथ एक होम बेकर हूं और बड़ा शौक था मुझे आप लोगों की तरह बहुत पढ़ लिख कर एक बहुत अच्छी वकील बनने का लेकिन शादी हो जाने की वजह से मैं सिर्फ मैट्रिक कर पाई कोई डिग्री नहीं है मेरे पास अलबत्ता लंबा तजर्बा है एक माँ होने का तो आज आपकी खिदमत में हाजिर हूँ बहुत शुक्रिया मुझे अपने साथ बिठाने का और मुझसे मेरे ख्यालात पूछने के
Thank you, Homa. So we will have a mix of 2 languages, as you noticed. Homa, who is representing actually the topic of today's discussion. The reason we wanted to have a mother is because a lot of time mothers are missing from all the discussion. We scientists, we are sitting all over the world. We talk of the issues of the mother, and I, for one, have never seen. Of course, all the scientists are mother as well, but they are not represented. So we wanted Homa to be part of it. So the purpose of this whole discussion is the Mother's Mental Health Month. We just celebrated Mother's Day past Sunday. I'm sure it's different in different countries, but at least in the United States. We at the AI-Sarosh project are working on few ideas to try to address the mental health of the mothers, and the people who are on this panel are actually representing. So what I would do is that I will start from Homa and ask her to tell us that while all the scientists like Dr. Lassi, Dr. Akhtar, and Dr. Richard, they are trying to develop these tools, to set the stage, if she can share her, what does it mean for her to when we say maternal mental health. तो हुमा आप अपना बताइए जब हम सारे साइंसदान जो कि हर एक है मेरी नज़र में तो आप अपना तजर्बा अपने ख्यालात थोड़ा सा हमें बताइए कि आपके जहन में जो ये मैटरनल मेंटल हेल्थ है उसके बारे में आपके क्या ख्यालात हैं
मेंटल हेल्थ के बारे में तो मैंने सच पूछे तो अभी जाना है, हमें तो इसके बारे में पता ही नहीं था। तो हमें मीन्स मुझे और मुझ जैसी सारी खवातीन को जो कि छोटी उम्र में जिनकी शादियां हो जाती हैं और फिर घर वाली हो जाती हैं, तो हमें पता ही नहीं था कि मेंटल हेल्थ है क्या चीज़। तो हम प्रेगनेंसी के दौरान और डिलीवरी के बाद जो फीलिंग हम महसूस करते थे, उदास रहना, चुप रहना और आसपास के लोगों का रवैया चाहे अच्छा भी होता, हमें लगता कि बड़ा जालिमाना रवैया है हमारे साथ। तो पता नहीं था कि ये सब क्यों हो रहा है, चूंकि इसकी कोई आगाही नहीं थी और न सिर्फ हमें कोई आगाही नहीं थी, तो हमारे आसपास रहने वाले हमारे बुजुर्गों को, हमारे बड़ों को जो सब कुछ हमें सिखाते थे, बहुत ज्यादा उन्होंने एजुकेट किया हमें, लेकिन वो खुद नहीं जानते थे शायद इस बारे में, तो उन्होंने हमें भी नहीं बताया। और हमें ऐसा लगता था कि जो मेरे साथ हो रहा है हर एक के साथ होता है और कोई नई बात नहीं है, मैं आहिस्ता आहिस्ता सब ठीक हो जाएगा। तो इस और ना ही कभी मतलब चूंकि पता नहीं था तो हमने किसी से जिक्र भी नहीं किया, बस बर्दाश्त करते रहे और वक्त गुजरता गया। तो अभी ऐसा लगता है कि जब अभी पता चला तो ये फीलिंग आती है कि हम ये सारी चीजें तो हमने भी महसूस की, हम भी यहाँ से गुजरे थे और हमने कभी खुद को इग्नोर किया, कभी घर वालों को चूंकि पता नहीं था जाहिर है वो भी इग्नोर करते रहे इस बात को। जितना हमें जानना चाहिए था इस बारे में, इतना हमें पता नहीं था कि मेंटल हेल्थ क्या है। तो मतलब मेरी जब पहली बेटी पैदा हुई तो मुझे लगता था कि अम्मी को तो मेरे साथ रहना चाहिए था, अम्मी क्यों चली गई मुझे छोड़कर, अब इसको मैं कैसे संभालूंगी, घर वाले क्यों ये तवक्को कर रहे हैं मुझसे कि मैं घर के काम में दोबारा से नए सिरे से हिस्सा लूं, अपने घर को संभालूं, शौहर और बाकी जिम्मेदारियां देखूं। तो ये सब अब पता चल रहा है कि मैं एक जिस स्टेज से गुजर रही थी उसको मेंटल हेल्थ कहते हैं, जिसकी मुझे सपोर्ट की जरूरत थी, लेकिन हम इतने बेखबर थे शायद कहूँ, या हम इतनी हिम्मत नहीं थी बताने की कि मैं क्या महसूस कर रही हूँ और मुझे क्या चाहिए। तो मेरा ये तजर्बा रहा है।
बहुत शुक्रिया. Thank you very much, Huma. And I think I'll just summarize for those who may not be able to understand. Huma said that she was not aware. And I think, Dr. Lassi, I'll ask you this question that from what we just heard from Huma is that it has always been there, right? I mean, but in the recent few years, there has been a lot of debate about it. So do you think that the mental health issues, especially for women, is this a new phenomena, or it has always been there? And we, even as a public health community, we have also realized it now.
Yeah. Okay. Thank you. It is always been there, but it is the thing that I mean, the awareness and is has increased. People have started realizing that mental health is an issue. It is as important as any physical health issue. So previously, where people used to ignore mental health, were not focusing on their mental health, now they have started realizing, because there are more voices for your mental health issues as well. And with the advancement, there are more screening tools, there are more assessments when women approach healthcare providers, they talk about mental health, or they hear about mental health from media, from social media, from television, from radio, from newspaper, that they now are more aware of mental health. So even it was always there, they have started realizing that it is an important issue and we should seek care for mental health. Yeah.
Thank you. And I think that's an important point to highlight that. I mean, a lot of people they may think that okay, it's a new phenomenon. I think that's a critical message from Huma's story, from your work, that we need to give to parents, to mothers, to be mothers, that this is something that can happen to everyone. I'll put the next question to Dr. Richard, who's definitely is a gynecologist and obstetrician. In your experience, Dr. Richard, how do I mean how do you manage it? I mean, are you increasingly seeing this these symptoms in patients, or how do you manage it? Tell us something about your experience.
Well, yeah. In Sri Lanka, Sri Lanka has a very good track record in the region with regards to reduction in the maternal mortality ratio. So currently, 29 per 100,000 maternal deaths we see in Sri Lanka, whereas in the regional countries it is very high. And out of these, about a significant number of maternal deaths occur due to suicide. So mothers in the recent years, 17% of the maternal deaths were due to suicides. Okay, and about 80% of them were less than 30 years old, and 30% of the maternal deaths were pre-planned. They were about 21% of them really had some form of previous attempts, and still we have missed. 30% of them were depressed, and 15% of them had some form of familial things. Their parents or family people have tried attempts and all. So it is very high. It's a significant problem. And 1 in 5 of them had some form of mental health issues. They had depression or anxiety or some form of major mental health issues, and though they were not actually detected and treated. So this is a significant problem. Unfortunately, when we are working in the hospitals, we often miss it because they are in the community, they come to the hospital, the meeting time is limited, so we don't have a time, or we don't get to clean them properly, and this go unaddressed. So we need to involve the community people. In Sri Lanka, we have a very good community antenatal care setup. So midwives go home to home, and they go and they can track. So what we are going to plan is, now we need to track them down in the field itself before they come to hospital. We need to track them, we need to intervene, and we need to treat them, and we need more support. So this AI solution, we think AI based interventions or detection tools can be very helpful, because because of the country's current economic crisis, a lot of doctors have migrated, especially psychiatrists. We lack psychiatrists. We need more people to detect and support these people. So AI based interventions will be a very good intervention in our setting.
Thank you, Dr. Richard. Yes, we will come back to the AI and the solutions that all of you are working. But I just wanted to go to Dr. Shaheen Akhtar from Bangladesh to tell us about there is a stigma to mental health, right? So what do you think about it, and what has been the experience from Bangladesh?
Okay, yeah. Thank you. It's a stigma if we consider from the point, because the whole issue is very much complex. I mean, when you consider the complex relationships, what I say, that between the mental health and the social cultural areas, if we consider, because it's not a kind of problem sometimes people know who have the problem, especially the women. Women are not that expressive because there are lots of issues there. It's not only from the family, it's a social issue. And you say that, yeah, oh, okay, she has some mental problem. Oh, she's mad or something like that. I mean, it's a kind of tag on her. And when you have this kind of tag, it's like that, okay, there are lots of issues jump on that because uh, the societal issue and the family issue. So it's a kind of pressure to the women. It's really very difficult to deal with this one. Even if I say the healthcare provider, so the problem is there because they don't want to come to the health for the health seeking they don't want to come to doctors, or they don't want to share their problem with anyone uh, in their community also because of this issue. So there are some other issues like the religious issues, some the spiritual issues on there. So it needs family support because you want to come to the health system, right? So someone to you, someone to understand your problem. But yes, the women had this kind of issues, some kind of mental health, whatever the situation. Because if you can have the early diagnosis and if you can cross this barrier, but still we don't know how can we overcome this stigma because this stigma is a recent experience heard from a higher class of a family was asking that it was like a very secret discussion. And just tell some of the psychiatrists I can seek some help because she didn't want to share this problem with anyone. Only value kind of secular issues or something like that.
Yeah. Thank you, Dr. Shaheen. And I think it's really important that, I mean, you have summarized it really well. And I'll encourage all the participants, if they have questions, please put them in the chat list, and then we'll ask those questions to the panelists for if you have any. So, Dr. Zora Lassi, there is a problem. But there is also a problem on the health system side. You heard that Dr. Richard and also Dr. Shaheen Akhtar, they're both mentioning about our ability. Number one, people do not realize. Once they realize, there is an access issue. So I know, I mean, there is a project that you are working on with the AI-Sarosh, the knowledge hub that we are. Can you please briefly explain to us that what is that and how are you trying to address some of the health system issues?
Okay. So basically, okay, I'll summarize what exactly we are trying to do as a project. So our project is focused on developing and evaluating an AI-based predictive model specifically designed to identify prenatal and postpartum anxiety and depression in women in Pakistan. So this initiative is actually conceptualized to bridge the significant gap in early detection and timely intervention, which is crucial for maternal mental health, as we all know. So by leveraging advanced artificial intelligence, we actually aim to provide healthcare professionals with a powerful tool to predict and manage these conditions before they actually occur. I mean, once we have the data set, we understand how this is happening and how soon it is happening and what are the factors that are contributing to the depression, we can early on implement some interventions to reduce the antenatal and postpartum depression, or at least we can provide support to deal with this. So this would lead to improved health outcomes for mothers and their children and the overall family. So this project not only addresses a pressing health care need, but also contributes to the broader goal of enhancing mental health support in underserved communities in Pakistan. Yeah.
Thank you. Thank you. I think this is really critical, and I think we are very proud of South Asian scientists taking the lead. So I'll go back to Dr. Shaheen. Dr. Shaheen, I know that you have been planning and thinking on a similar idea that Dr. Zaralasi's team is doing. So briefly, can you explain what is your idea and how are you trying to address this using artificial intelligence?
Yeah, sure. I'll just go back on that. Why we jump to choose these topics: the mental health and the depression, maternal depressions, both the antenatal and the postnatal depression. Uh, so, if you consider that the mental health issue, women sometimes they don't consider it's an issue. It should come, you should bring it on surface. They don't feel sometimes. And there is a study in our country. So it said that two-thirds of the women they don't feel it's the problem. Okay, it's in there. Maybe it's an issue for a while or something like that. But so there is no kind of awareness on that problem. And there is other issue on the other part. We have a very limited number of psychiatrists within our country who can give the services. Only if we consider only 0.4% psychiatrists to serve these 160 million people in Bangladesh. So it's a very tiny number. So considering all these issues, then we thought that we should start something on that can we can at least identify the problem of the mental health problem, the depression, the maternal. This is a very important issue, maternal depression. It has lots of consequences. Uh, on keeping this on our mind, so we design our project that what can we do? How can we pick up the cases and bring them on the counseling or on the treatment on this part? Uh, so our project we designed that, okay, we will design some model on AI-based model that can identify the perinatal depression. And it's not like that you need any healthcare providers, and it can be a nurse or other paramedics, or they can also use the tool and they can identify, it's not the diagnosis, they can identify the cases and can link the cases to for referral or something to have addressed their problem. So our idea was like this, and keeping this on mind, and we through our project actually we are trying to gathering in an innovative way. So we will do some kind of eye tracking. We will use some multimodal model and also the facial expression and also the some acoustic feature. There is speech. So all these things we will gather through our model, and then we'll come up with some of the solution that can identify the perinatal depression in the cases. So our cases will be, I told you, the antenatal mother, and we will extend the postpartum period up to 1 year of the childbirth. So this is very short about healthcare.
Thank you, Dr. Akhtar. I think it's very innovative, but at the same time very challenging. So we definitely are looking forward to the results as we move forward on that project. Dr. Richard, so as a person who is seeing patients and managing patients, how do you see the utility of these add-on tools in your practice?
Well, it is in our setting we have been using Edinburgh postpartum depression scale. Uh, that scale is the popular one. The midwives, when they go home in the field after delivery, we send them home. So they are supposed to visit the women within 10 days. So they are able to capture at least a little bit of a number by administering this questionnaire. But this is, although this is in our health practice, it is not happening because of the issues pertaining to this paper based questionnaires. You hand over and you expect them to fill it and give them back. It is not happening. So there are some practical issues. Sometimes all of a sudden midwife may visit their homes without the questionnaire, and we don't get a return. But however, in our system, if we can use, if we can find an innovative tool, that can easily capture some features.
Thank you. तो हुमा, मैं आपने सुना कि सब मुख्तलिफ किस्म के नए टूल्स डेवलप कर रहे हैं, बहुत सारी चीज़ें अवेलेबल हैं आप जैसे लोगों के लिए, माँओं के लिए, हमारी माँओं के लिए। तो आप क्या समझते हैं कि जी आपने कहा कि जी हमें पता ही नहीं था, तो किस तरह की चीज़ें हम बनाएँ कि जिसकी वजह से एक तो मालूमात मिलें आप लोगों को, और दूसरा ये कि अगर मालूमात मिलें तो उसके नतीजे में आप सेहत की सहूलतें या जो भी सहूलत है उसको आपको मुयस्सर भी हो। तो आप बहैसियत एक इस्तेमाल करने वाले के हमें बताइए थोड़ा-सा कि आप क्या चाहेंगे?
मतलब मैं आप लोगों की बातें सुन रही हूँ तो मुझे लग रहा है कि इस मैं से ज़हनी तनाव कहूँगी, आप मेंटल हेल्थ कह रहे हैं, तो इसका ताल्लुक मेडिकल से भी है। तो मैं बज़ात खुद अपना तजर्बा बयान कर रही हूँ कि मैं जिन दिनों तो मुझे पता नहीं था, बच्चे जब पैदा हुए और उसके बाद भी मैं बहुत ज़्यादा ज़हनी तनाव से गुजरी हूँ, क्योंकि मेरे शौहर को किडनैप किया गया और उसके बाद मैं बहुत ज़्यादा स्ट्रेस में रही, जिसकी वजह से कभी कंधों में, कमर में, टांगों में, मुख्तलिफ जगह शदीद दर्द महसूस करती थी मैं। तो और उसके लिए मैं डॉक्टर से कंसल्ट करती थी, डॉक्टर के पास जाऊं तो जिस भी डॉक्टर के पास जाती तो वो मुझे कभी MRI करवा रहे हैं, एक्सरेज करवा रहे हैं, टेस्ट दे रहे हैं, और फिर उन सब के नतीजे में मतलब इतनी लंबी हिस्ट्री मेरी सुनने के बाद डॉक्टर साहिबान मुझे खुश रहने का वो देते, आप खुश रहा कर। तो कई बार तो मैं बहुत चिढ़ जाती थी इस बात से कि खुश रहा करें, इससे क्या मतलब है, मैं कैसे ये भी बता दें मैं कैसे खुश रहूं, ऐसी कोई गोली दे दें। तो और मुझे जो है रिलैक्सिंग गोलियां दी, जिसकी मुझे आदत पड़ गई आज तक कि मैं रात को जब तक नींद की गोली नहीं लेती हूँ मैं सो नहीं पाती। तो ये मेरे डॉक्टर साहिबान का तोहफा। और एक वाकया अपना सुनाती चलूँ आपको कि MI रिपोर्ट के बाद और ये सारे रिजल्ट और ये डॉक्टर साहब देख रहे थे, तो बड़े मशहूर डॉक्टर हैं हमारे, तो उनको जब मैंने दिखाया तो देख रहे हैं, कहते हैं कि सब बिल्कुल ठीक है, कुछ भी नहीं हुआ, सब बिल्कुल ठीक है। तो मैंने एक सवाल पूछा उनसे, मैंने कहा डॉक्टर साहब जब सब ठीक है फिर मैं क्यों, मुझे दर्द फील हो रहा है, मैं क्यों बीमार हूँ फिर? इसके जवाब में पता है डॉक्टर साहब ने मुझे क्या कहा था? क्या सुनना चाहती हैं आप? आपको ये कहूँ आपको ब्रेन ट्यूमर है? आपको कहूँ कि आपको की जिंदगी के कुछ दिन बाकी रहते हैं, ये सुनना चाहती हैं? अगर ये सुनना चाहती हैं तो ऐसा नहीं है, आपको कोई तकलीफ नहीं। तो उस दिन मैं घर आकर बहुत रोई थी कि मैं झूठ बोल रही हूँ, मुझे दर्द है कमर में बहुत शदीद, या मेरे मसल्स बहुत ज्यादा वीक हो रहे हैं, या जो है डॉक्टर साहब सही कह रहे हैं, मैं बिल्कुल ठीक हूँ, मैं सिर्फ तवज्जो हासिल करने के लिए ये सब कर रही हूँ। तो अब जब मैं सुन रही हूँ कि काम हो रहा है तो इब्तदाई मराहिल तो एक और माँ होने की हैसियत से अपने बच्चियों के लिए मैं बहुत ज़्यादा चाहूँगी कि इस पे बहुत अच्छा है कि काम हो रहा है, बच्चों को अवेयरनेस मिल रही है, हम सबको, हम जैसे जो अब इस स्टेज पर पहुंचकर भी हमें डॉक्टर साहिबान की हमदर्दियों की ज़रूरत है, और ये जानने की ज़रूरत है कि वो हमें ये बताएं कि आपको ये तकलीफ है, आप जाएं किसी साइकियाट्रिस्ट के पास जाएं या कोई थेरेपी करवाएं, ऐसा कोई मशवरा दें, और डॉक्टर साहब के तवज्जो से सुनने और प्यार से बात करने से भी आधी तकलीफ खत्म हो जाती है। ये मेरा तजर्बा है। तो
शुक्रिया।
मेरा
हाँ, नहीं और आपको यहाँ पे बुलाने का मकसद भी ये था कि हम थोड़ा-सा वो जो तजुर्बात हैं लोगों के, हमारी माँओं के, हमारे वो सुनें, और अगर हम कोई चीज़ें बना रहे हैं उनको हम किस तरह से। एक सवाल भी है हमारे एक पार्टिसिपेंट का, डिज़ाइन थिंकिंग। Dr. Lassi, though, I'll just take this story, what you heard from Homa, to you, that how do we make sure, while we are talking about artificial intelligence, can this address the issue that Homa just highlighted? And if it can, how?
Okay, very interesting question. How artificial intelligence can help, right? Is this the question?
Yeah. Yes. Yeah.
Okay. All right. So see, artificial intelligence I mean, since it's a very start of using artificial intelligence, so at the very start, artificial intelligence will help us learn what is happening. I mean, how it is distributed, what are the factors, different variables that are working together in just, in this depression. I mean, what are the factors from the individual level, from the family level, from the society level? What are the different factors that play a part in postpartum depression or in maternal mental health? So artificial intelligence at the very first help us understand the numbers, the factors that are associated with mental health, and then help us learn how we can identify women with these problems. So once we have this data in hand, we can easily understand that if for example, there is a woman with these factors already there, if a woman has some individual factors which are already there, there are some, financial hardships that that particular family is going through. There are some, let's say housing problems that they are dealing with. So that would, when we feed in all this information, that would help us identify that what is the chances for that particular woman to develop a mental health issue. So that would help us identify mental health issues early on in life. And similarly, once we'll understand all these factors, we can easily devise the interventions or programs that can target and reduce these mental health issues early on as well. So as we learn the data, as we learn how it is, developing, the disease or the mental health issues are developing, we can also learn what are the interventions that can help mitigate the issues as well. I hope I have answered the question.
No, I think you have definitely answered. Um, there is a lot of expectation of us from artificial intelligence, and I think it's really critical for us to uh, try to be sensitive about the different steps and how do we collect that information. Dr. Shaheen Akhtar, what has been your experience in data? Because artificial intelligence without data cannot
Is
be.
nothing.
So how are you making sure that whatever data is available, or how are you trying to capture data to try to come up with these tools?
Okay, we are trying to collect data, just I will describe something that EPDS system also we are using. We will do the screening to the mothers, group of mothers 15 to 49 years, and from that screening, we'll sort out the depression process. We'll make them separate, and then we'll go to the another tool, or is there still in there the PHQ-9 also we are using, because we want to compare whatever the AI data, and also we are putting on top of that, we will also do some of the psychiatric evaluation for around 50% of the cases. So we want to gather the data to all these one, and also we are collecting the social demographic and the maternal data that just mentioned by uh, Dr. Zahra, that also we are collecting the maternal well-being and other data. So we will do some of the cross-checking, what I will say, with all these one, there will be a comparison, because we are collecting also There's a specific feature we found in many literature and in other countries. They have kind of data in there for the depression that there's specific gaze pattern, some specific gaze pattern for the depression cases. They have some specific gaze kind of deviation, and there's some features in there that can help us to say, okay, this can be a case of depression. And also there are some feature in your facial expression. When you set in front of the eye tracking, it will also record the facial expression. So there are some specific feature for the depression cases for the facial expression. So this data we will gather, and also we have kind of speech when we talk with the women. They will also record that speech. The patient has some specific features. They have the low pitch and some other features. So we are gathering all these. All this, so I told that it will be multimodal, not the one, because sometimes for the severe depression cases, they don't look to the, there's some challenges for the eye tracking. So at least you can use other modalities like the facial expression and also the acoustic features, speeches. So all go through some kind of algorithm there, and these will be compared. We are comparing these with other model also, existing model they have. So we
All right.
are hoping that all this all together, like we can compare with this data with our psychiatric evaluation, and PHQ-9 have a very high specificity and sensitivity. So all
Okay.
these when we compare, so we are hoping that it will come up with some good solution for
All
for
right.
for the diagnosis of the depression.
Thank you, Dr. Shaheen Akhtar. And I think this topic is such a vast and interesting. We can go on and on. I just would like to. There were two areas that have been highlighted in the chat box by our participants, and I'll put those as question to Dr. Richard. One is that the we don't have many mental health specialists in our region. And the other is that how do we reach out to the rural population? So there's a two critical questions. While we are talking about this issue, this is highlighted. We don't do we have enough resource? You mentioned about healthcare workers. Uh, I
Yes,
just wanted to give you a chance to
yes.
address those
This
two
is,
questions.
yeah, we have to basically, these policies, this is actually at the hands of policy makers as well. Health should be made as a, the priority thing in the, like any other medical problems, because in many countries mental health issues are ignored aspect in their healthcare system. So we should be able to urge, or we should be able to uh, communicate with the policymakers, healthcare administrators to uh, increase the care, that is, increase the care in various regions. And also, even, to pick up health related issues, you don't necessarily have to have a specialist, or you don't, even basic healthcare workers, social health workers, the people who can work in the field can pick up a lot of things. This is not a, for example, to pick up a woman who is depressed, I don't think would need a big kind of, medical training. Some form of assessment using tools can be enough. So we need to increase the, I think, training, capacity building programs, and improve the access to the care. These things actually sometimes can be beyond our control as well. We need to urge the policymakers and healthcare administrators to increase the capacity to capture these, or care for these vulnerable women.
Yeah, since we are reaching the end of our session, Dr. Lassi, you highlighted the multi-sectoral context. I just wanted to give you the opportunity to try to see that it should, I mean, what I take is that it is not just a medical condition. There are multiple other reasons. Your take on that?
Yes, I mean, if we talk about maternal mental health, there are multitude of factors that play a part in developing these issues. So as I mentioned earlier, there are individual level factors, but there are some community level factors and some societal level factors that play a part in mental health issues. So we need to understand all of these, and we need to try and develop a program that can mitigate or target all these factors. Of course, it is very difficult to cater to each of these factors, which are, sometimes very big issues at the same time. But there should be programs that should target all these different level factors. Otherwise, it would be very difficult to tackle mental health issues. So a lot of different things that can play a part in mitigating it as well. There are some traditional practices, there are some community structures that play a part. So for example, if women um, feel safe within extended families, or within the structure of where they have elders in the family, those who can provide or offer emotional support, spiritual sort of support, that really helps women. But at the same time, they need support from healthcare workers as well. And as mentioned earlier by the other colleague, there we really don't need an expert or an expert healthcare professional in for this matter. Sometimes, community health workers can play a very big role in targeting these diseases, not only in identify, but helping to find a referral or seek care for mental health issues. So there are different factors that play a part, but there are different things that can, help in mitigating these issues at the same time as well. Yeah.
I think that is critical.
Yeah.
The point that you have highlighted is really important. Uh, what definitely the recognition of an issue is one, but there are structures within our society, within our community, within a household
Yeah.
that should be highlighted. And I think the value of uh, our social structure, especially in the South Asia region, is really important, and I think that that should be focused. Ideally, as Dr. Ishad mentioned, that the health policymakers should design a health system that reaches each and every individual. But we know that health is not a priority for policymakers, unfortunately. I hope we do a better job to convince them. Um, we are at time. We have completed our 45 minutes. There is a question about, I think, Dr. Lassi, about the how screening tools, AI-driven screening tools, improve early identification of perinatal depression compared to. So I'll just say that since we don't have time, wait for Dr. Lassi's publication, and then you will find out. And I'm sure there are other papers that have been published as well. So with this, I think thank you very much for the panelists. It was really a learning experience even for me to try to. But I think to cover this topic in 45 minutes is not possible. But the purpose was just to create awareness so that we can continue talking about it. We increase awareness. We talk about issues. We talk about solutions, and the knowledge should be led from where the problem is, rather than we adopting any tools that may not be customized to our local needs. Thank you, Dr. Lassi. Thank you, Ms. Huma Mirza. Thank you, Dr. Shaheen Akhtar. And thank you, Dr. Rashid. And thank you, all the participants. Thank you very much. Please continue to follow us on our social media. We will come back to you with more similar webinars, and we look forward to your participation and engagement.
Thank you.
Thank
Thank you
you.
for having us.
Bye.
Bye.
Bye.